Not all people with aneurysms need to be treated, right, if found early enough, doctor?
Yeah, I think it's important to understand that if you have an aneurysm, most aneurysms don't rupture, in fact, and many of them are very small. And if you have a small aneurysm, it's very in your aorta, we're generally going to recommend follow-up surveillance, most often with ultrasound, particularly when they're small, because it's the simplest way to look at these aneurysms. It doesn't involve any radiation exposure at all. But as the aneurysm gets bigger, we need a more precise way of evaluating size, and it's more likely that your doctor might represent a CT scan or recommend a CT scan.
So, doctor, obviously depending on the size and depending on the rate at which it's growing, would that then depend on maybe just waiting, or you do something immediately?
Well, if the aneurysm is small, we recommend surveillance, and we have certain size and characteristics where we might recommend treatment. Most patients enter this surveillance program, and that's generally done once a year. If the aneurysm grows more than 10% in 1 year, we might recommend treatment. Or if the aneurysm gets to be about 5.5 to 6 centimeters, we would recommend treatment. Now, we have some patients who have a family history of aneurysm, or perhaps their parents have experienced a rupture, or somebody else in their family may have had a rupture. In those cases, because of anxiety and dealing with everything else regarding the fear of having it, we tend to treat those patients a little bit a smaller size.
It makes sense.
So we're not very good at looking at a CAT scan and saying, you know what, this aneurysm looks like high risk for rupture because it looks this way. It really still remains mostly size. The other times we treat patients with smaller aneurysms if they have a work life in which they travel and they're remote from the provision of health care. So some of our patients who are international travelers, who are frequently away from home and work in places that they may not know what the access to health care is, and they know they have a potential problem, we might treat those patients at a little smaller size.